Evening na pala, sorry. So good evening everyone. We will be discussing about your RBC anomalies. No? So what are these RBC anomalies? Okay. So first, you have your variation in hemoglobin content. Okay. So for hemoglobin content, as you can see, no, as I said, hemoglobin. Okay. And its content. Ano ba yung mga content ng hemoglobin natin? Ha? Ano ba yung content ng hemoglobin natin? The pigment itself. Okay? Pigment. Okay? So here, we will be correlating this to your color of the cell. Okay? The color of the cell. So if it's normochromic, when you say normo, okay, that's normal. Okay? Chromic means color. Okay? So if your pigment or your hemoglobin in your RBC is normal, then the cell is normochromic. Oh. How would you know if it's normochromic? Okay? Anong pinagbabasihan natin dito sa normochromic? Your mean cell, mean cell volume. Okay? MCV. Okay, if your MCV is less than or greater than the reference range. Okay? What is the reference range for your MCV? Do you know what is the reference range for your MCV? Huh? Your MCV, the reference range for your MCV is your 14 point, sorry, 32 to 36 gram per deciliter. Okay? So your MCV is equals to 32 to 36 gram per deciliter. Okay? That is the normal amount. Okay. Ano yun? No? Your RBC has a central pallor of its 1/3 of the cell. 1/3. If it's 1/3, then your cell is considered to be normochromic. Okay. When it's now less than the reference range of 32, no, less than 32 grams per deciliter, okay, of your MCV, then your cell to be considered is hypochromic. Hypo means low, and your chromic means color. Okay, it has less than, no, color than the normal RBC. Okay, so the central area of your RBC is now so big. Why? So your RBC denotes that the central pallor is too wide. Okay? Too wide, greater than 1/3 of your cell. Okay? So this is usually, okay, associated with your microcytosis. No? The shrinkage of your cell. RBC cell. Okay? RBCs. Next is your hyperchromic. No? So hyperchromic, as the word itself, hyper, high. Okay? So, the cell has an increased hemoglobin content. Okay. So, sa ganitong cell, no, greater than 36 gram per deciliter. Okay? The cell has greater than 36 gram per deciliter content. Okay. Ano na, may central pallor pa ba? No, wala nang central pallor. You can only see a large cell there. No? Red cell na lang yan. No? Dark coloring red cell. Or it has too much of that hemoglobin content that it depicts as a dark coloring cell. Okay. Next is the variation on your staining property. Okay? Now we consider this as your polychromatophilia or your polychromasia or diffuse basophilia. So with this, okay, your cell is too much stained, no? O kaya, it takes too much of the stain. Okay? That's why it has a blue tinge of pink. Okay? So, nagbavary yung cell mo, blue with tinge of pink. Bakit? Masyado pa siyang staining ng basic dye. Okay? So, your RBC is an eosinophilic cell. So, it should have only taken your eosine dye. Okay? But in this case, na merong polychromatophilia or polychromasia or diffuse basophilia, your cell will accumulate or get some of that basic dye. And what is the culprit for that? The RNA content of your RBC. Okay? Usually we can see this on your um what do you call this? On your reticulocyte. Okay? You can see that RNA content on your retics but not on your matured RBC. So if ever that your matured RBC takes basic dye, then it will be considered as polychromatophilia or polychromasia. Okay? Okay, so for polychromasia, condition wherein the red cell are stained, as said kanina, shade of blue with tinge of pink. Okay? So you can see this, slightly, the cell is slightly microcytic. Anong normal cell size natin? Our normal cell size is 6 to 8 micrometer. Okay? So your microcytic is less than sorry. Okay, less than 6, micrometer. So usually your polychromatic cells are microcytic. Okay? Also, it indicates reticulocytosis. As I said kanina, we can only see your RNAs, your RNA to your retics. Okay? Kaya, if you suspect that the patient has a polychromasia, then you can consider this cell as reticulocyte. Okay? For your retics, only contain the RNA that is in the peripheral blood. Your normal RBC doesn't have RNA to its cell. Okay? Okay, next. No? So how do we grade that polychromasia? No, we grade that as 2, slight, plus 1 plus, 2 plus, 3 plus, and 4 plus. Okay. That is graded as to 1% of the percentage of your RBC, are polychromatophilic. So if your count is on your 100 cell count of RBC, okay, one of that is polychromasia, polychromatophilic. Okay, that is graded as slight. Okay, slight polychromatophilia or polychromasia. Okay, when it's 3%, okay, 3 of that 100 is noted to be polychromatic, then the grading of your polychromasia is +1. Then and so on and so on. Greater than 11% is 4 plus of your polychromatophilia. Next, your hypochromasia. Okay? Ito naman is less than the color of your normal RBC. Okay? So, less than the color of your normal RBC. It appears pale. Okay? Maputla. So, as you can see here, this cell, okay, more than one-third yung area ng pallor niya. Okay? So you can see that that's a hypochromic cell. Another example is this one. Okay? Paano masabing normal, sir? Okay, you can say that it's normal when it's look like this. Okay, almost one-third of the cell is only pallor or pale colored. More than one-third of that considered as your hypochromasia. Other cells that are not circular in there are your other RBC deformities. Okay, we will discuss that later on. Okay, what are the two possible causes of your hypochromasia? So first is decrease in hemoglobin content. Okay, mababa daw ang hemoglobin ng pasyente mo. Ano yung mga cause nun? Either anemia. Okay? So, yung mga yan. Abnormalities on the thinness of the cell. No? Anemia. Thalassemia. And idiopathic. Ano to? IDA. Idiopathic deficiency anemia. Or, sorry. It's iron deficiency anemia. It is iron deficiency anemia. Okay? So, that are the normal cause, no? Of your hypochromasia in our patient, no? Either iron deficiency, sideroblastic, and thalassemias. Okay? Next, the grading of your hypochromasia. Okay? As to that, okay. As to that, no? You have your 1 plus, which is described as the area of central pallor, is 1/2 of the cell diameter. Kalahati ng cell ay pale. Okay? Your 2 plus is 2/3 of the cell. No? More than the half of your cell. 3 plus, 3/4. No? Konting-konti na lang yung dark. Then 4 plus is thin rim of hemoglobin. Paano madidepict yan? Parang halos yung membrane lang yung nakikita mo. Okay, itong 3/4, medyo malaki pa yan. Okay? Itong 2/3, medyo pa ganyan na yan. Pero medyo malaki pa rin. Okay? Siyempre, yung ano is 1/2. No? Ganyan. Okay? So, you can see that. No? You can describe that as your hypochromasia. Okay. So, when you're hyperchromasia, okay, too much color, no, condition wherein the red cell is deeply stained. Okay? Sobrang dark ng stain. No? This is usually caused by your abnormal thickening of the cell. Usually associated to your macrocytosis, which is larger than 8 micrometer size. Spherocytosis, which is your RBC are in the shape of spear. No? Sobrang bilog niya. At darkly stained. No? Wala siyang central pallor. Okay? That's your spherocytosis. Then your megaloblastic anemia also causes your hyperchromasia. Okay? May mga anemia tayo na nagkukos ng hyperchromasia, not only in the decrease of your hemoglobin content. Okay? So this, as you can see this, no? The picture on the right, you cannot identify or is the RBC there. You can only identify immature. Okay? Immature. Okay. Next, you have the variation in size. After we have the variation in color, next we'll have your variation in size. So as the variation in size, as I said in the last lecture to you, okay, anisocytosis. Okay, it is the variation of cell size. The anisocytosis is the cell variation on size. Okay, you will note this as your macrocyte and microcyte. Macro and micro. Okay? So kanina binanggit ko na din what is your normal RBC size? it's 6 to 8 micrometer. Okay? 6 to 8 micrometer. Okay. Less than 6 micrometer, it's your microsites. Greater than 8, macro. Okay? Usually, no, these cells are associated with acute post-hemorrhagic anemia, no, after hemorrhage, okay, o kaya hemolytic anemia, no, or aplastic. No, no cell is being produced. Okay, so your macrocytes, no, usually the MCV is greater than 100. Okay, then the defect is the abnormal nuclear maturation but normal cytoplasmic maturation. Okay, the nucleus, okay, the nuclear maturation, no, masyadong malaki. Kaya nga, nagiging macrocyte siya. Okay? Associated non-megaloblastic anemia, myelodysplastic syndrome, chronic liver disease, bone marrow failure, and reticulocytosis. While your microcytes, no, it is less than 6 in micrometer, and your MCV is less than 80 femtoliter, okay, the abnormality is found in the cytoplasmic maturation naman. Cytoplastic maturation. But normal in your nuclear maturation. So they are, ano, magkabaliktad si macro and micro. Pag kay macro, it is on your nuclear maturation. While on your micro, it is in your cytoplasmic. Okay? Associated disease is your IDA, yung iron deficiency anemia, thalassemia, hemolytic anemia, hemoglobin E, okay? Chronic post-hemorrhagic anemia, sideroblastic anemia, and also in your inflammation. You can see microcytes. Okay? Next is your megalocyte, no? Large oval-shaped cell which is 9 to 12 micrometer. So we consider greater than 9 or 9 to 12 micrometer is your megalocyte. Okay? Larger than your macrocyte. Okay? So abnormality, same with your macrocyte, no? Usually your macrocyte is 9, no? 9, 10, 11, 12, no? Pero ang 9 to 12, you consider as megalocyte. But 13, 14, 15, and so on, na mas malaki pa, it's macrocyte. Okay? Generally known as your macrocyte. Okay? Megalocytosis is found or depicted by your megaloblastic anemia, like your pernicious anemia, okay? Your common anemia, vitamin B12 deficiency, okay? And dipolybotrium latum infection. Bakit? Matakaw si latum sa RBC. Okay, next is the variation in shape. Okay? As to your shape, you depict this or you note this as your poikilocytosis. Variation in shape. On your size is anisocytosis. Shape is poikilocytosis. Okay, your normal cell is called as discocyte or discoid shape. Okay, biconcave disc with an increased surface area volume surface. Okay. Associated disease with your discocytes. Okay. Normal condition, also seen in acute hemorrhagic anemia and aplastic anemia. Okay, even though your discocytes are normal, you can see them on your abnormal or disease causing illnesses. So first in the list is your acanthocytes. So your acanthocytes are your spur cells. Okay? They are small dense RBC with few irregular shape projections. Few irregular shape projection. No, that varies in length. Medyo magkakaiba ang itsura. So yan, yung mga yan. That's your acanthocytes. So ito pa. Yan. Okay? Nag-iiba-iba yung haba ng mga spur niya. Kaya spur cell. Okay? So ito pa. Yan, iba-iba. No? So mukha siyang ditto. Then, no? Your defects, no, normally this is seen in your abnormal membrane defect. Okay? Which is caused by your increased sphingomyelin and decrease in cholesterol and phospholipid. So, diniscuss ko yan sa inyo, ang content ng RBC natin. Ano yon? Meron tayong sphingomyelin, meron tayong cholesterol and phospholipid. So, the RBC membrane, no, ito ang defect ni acanthocyte, itong tatlo na to. Increase kay sphingo, decrease kay cholesterol and phospholipid. Okay. Saan associated ang spirocytes, spur cell or acanthocytes, sorry, to your neuroacanthosis, okay, abetalipoproteinemia, macleoid syndrome. Others is your severe liver disease. Okay? Nade-disintegrate ang cell membrane. Next is your biscuit cell or your folded RBC. So your folded RBC, the defect is the cell membrane. Okay? Usually seen in your hemoglobin SC and C disease. Okay? Usually mukha siya yan, naka-roll, no? Nakatiklop. Nakatiklop yung RBC niya. Folded cell. Next is your Burr cell. Okay? Pag Burr, abnormal in the lipid content. Lipid content lang. Kanina, kay spur cell, no? Meron tayong cholesterol, phospholipid, and sphingomyelin. Dito, lipid membrane lang. Or lipid content of the membrane. Okay? The cell with irregular, no, space blunt processes resemble your crenated RBC. Pag sinating nating crenated, mga shrink RBC. Okay? Yeah. Echinocytes, also known as echinocytes. But what is the difference between your Burr cell and your spur cell? This one is usually equal yung size ng projections. While your spur cell are irregular, no? Uneven. Okay? Associated disease, your uremia, your MAHA, microangiopathic hemolytic anemia, your liver diseases, your DIC, no, disseminated intravascular coagulation, your TTP or your thrombocytopenic purpura, and your PK or your PK is your I forgot. Okay? Sige. Hanapin natin yan mamaya. Lalahanin natin. Okay. Blister cells known as your bite cell. Bakit bite cell? Kasi mukha siyang kinagatan. Yan. Mukha may kagat. Yan. Okay? Yan. May mga mukhang kagat. Okay. Defect is your G6PD. Okay? Your glucose 6-phosphate deficiency. No? So, yung may mga G6PD natin, which is immune disease, okay, has this defect on their RBC. No? This is usually resulting to the accumulation of your Haynes bodies. So, this is a RBC inclusion. Later on, we will discuss that also. Okay. The cell looks like, no, with centric vacuoles due to the plucked out Heinz body. Okay? Then associated diseases, your G6PD of course, your HUS, and your MAHA. Hemolytic uremic syndrome is your HUS. Okay. So next is your echinocytes or crenated cells. They are the sea urchin cells. Okay? Known to be as your sea urchin. Bakit sea urchin? Mukha siyang sea urchin po. Okay? The defect is in the ATP production. Usually caused also by your prolonged storage of anticoagulated blood. Pathologic due to the abnormal lipid content of your RBC membrane. So, medyo increase ang lipid content niya. Same with your, same with your bursates, no? Lipid content. No, associated diseases are, no, usually artifactual or due to the prolonged standing, synuria also, bleeding ulcers, gastric carcinoma, hepatitis, and cirrhosis, liver cirrhosis. Next is your podocytes. Now, this is known to be your target cell, Mexican hot cell. Bakit po? Mukha po siyang target because you have the normal RBC. Okay? Meron siyang pabilog-bilog. Yan. Meron siyang pabilog-bilog. Okay? Imbis na dalawa lang yung makikita mo, okay, parang ganito lang, dalawa lang, nagkakaroon pa ng isa pang bilog sa gitna. That's why it is also called as bullseye appearance. Okay, the defect is in the cholesterol and phospholipid of the membrane. Also seen in your lecithin cholesterol acyltransferase, no, or your LCAP. Okay, dalawa ang defect niya, kay cholesterol and your kay LCAP. Okay. So sinabi ko nga, no, nagdo-double yung ring niya, no? The cell with central area of hemoglobin surrounded by your colorless area and a peripheral ring. So may additional ring siyang nakikita, kaya tayo nagiging bullseye appearance. Okay, associated disease are your thalassemia, liver diseases, hemolytic anemia, hemoglobin S, hemoglobin C, and then your LCAT deficiency. Okay. Next is your dacryocyte or teardrop cell. This is abnormal match-raising squeezing, no? And fragmentation during splenic passage. No? Pag sinabi splenic passage, pag dumadaan na sila sa spleen, okay, nagkakaroon na sila ng membrane defect kasi hindi nila masyado ma-squeeze yung mga sarili nila and they cannot go back into their discoid shape. Okay? So, usually, they look like a teardrop. Yan, parang luha. So, makikita natin yan pag mga exam, luha. Okay? Yan, teardrop shape or pear shape. No? One end is pointed. Okay, associated disease is your HA, hemolytic anemia, yung megaloblastic anemia, and your MMM. Next is your elliptocytes. Okay, your elliptocytes is also known as your ovalocyte. Bakit ovalocyte? Bakit elliptocyte? They look like a oval in shape. Yan. Yung mga yan, no? Kitang-kita. Ito, dito. Yan, oval in shape. Now, the defect is usually in the spectrine and band protein 4.1. So, ano yung sinasabi natin? Yung spectrine at yung band 4.1 natin is the skeletal system of your RBC. Kaya, if ever na may defect or kulang ka dyan, your RBC will be in shape of your elliptocyte. Okay? Also known as sugar shape. Yeah, mga yan. Sugar shape, egg shape. Okay? The hemoglobin appears to be concentrated at both ends. Okay? Nagko-concentrate yung hemoglobin mo sa dalawang dulo. That's why, and your cell would look like an oval. Nahatak nila sa two opposite side. Kaya yan, nagiging oval. Okay? The lifespan is also shortened. Siyempre, kulang ang spectrin at band protein mo. Mas madaling masira ang cell. Kasi skeletal system nga natin yan ng RBC. Okay? They can also be found in a healthy person. But usually, this is related to your megaloblastic anemia, hypochromic anemia, hereditary ovalocytosis. Additional to that is your EDA or your iron deficiency anemia, thalassemia major, and your myelodysplastic anemia. Myeloptysic anemia. Okay, additional to that. Next is your spirocytes. Okay, sinabi ko na kanina, binanggit natin yung spirocytes. Ano? They are usually ball lang, bilog na bilog, sobrang dark, staining. Wala na yung central pallor mo. Bakit? No? Sobra yung hemoglobin content. Okay? Usually also has a defect in your spectrin. Associated diseases is your hereditary spirocytosis, chronic lymphocytic leukemia, CLL, okay? Immune hemolytic anemia, and due to your ABO incompatibility. Additional to that, no, it can also be seen in your extensive burns. No? Alongside with your schistocyte. Okay? Sige. Next is your sickle cell. Okay? Sickle cell. No? Crescent shape. So this one is sickle, this one is sickle, this one is sickle. Okay? Usually the abnormal aggregation of your hemoglobin S, which give the tendency for the cell to assume a sickle shape. Okay? It is thin, no? Thin and elongated with pointed ends and are well filled by your hemoglobin. They can be seen also in other shapes like your S, V, or L shapes. Okay? Usually found in a sickle cell anemia and sickle cell trait. Okay? Also known as your depranocytes. Next is your schistocytes or your fragmented cells. Okay, schistocytes, no? Cell fragmentation due to trauma caused by your physical and mechanical agents. Okay? Also, this is being associated to the rupture of the cell during the circulation in your body. Okay. Found in your MAHA, microangiopathic hemolytic anemia, TTP, okay, the ICHUS, uremia. Also, you can also see this in your extensive burn. Okay, schistocyte. Next is your stomatocyte or your mouth cells. Okay? Bakit mouth? Mukha po siyang may bibig. Mukhang bibig yung gitna niya. Okay, yung central pallor niya looks like a mouth. Kaya, mouth cell. Okay, anong defect niyan? Okay, usually due to the cation imbalance. No? Usually, due to the cation imbalance to your sodium and potassium. Usually found in your alcoholic cirrhosis, no, liver cirrhosis, hereditary stomatocytosis, hepatobiliary disease, and then your Rh null syndrome. Okay? Usually, this is also caused by your artifacts. Bakit? They are fragmented cells. So, minsan humahalo na lang sila basta-basta. Okay? Okay. So, usually, no, the pathological changes in the RBC is explained like this. Now, this is the pathophysiology of your cell. Okay, your normal RBC, okay, can be variated in your size. Okay, may micro, due to the possible defect on your bone marrow. Okay, the production of the cell. It does have defect in the production. Same goes to your poikilocytosis. Okay. So those are the variation in your size and shape. Then your variation in size, now macro and micro, small, large and small. Okay? Macrocytosis greater than 8 micrometer. Microcytosis less than 6 micrometer. Poikilocytosis or irregular in shape. Okay? You can see that as the appearance of your cell. Okay. Irregular borders like your burr cell or fragmented cells such as your schistocytes, sickle cell. Next abnormality on your RBC is on the hemoglobin content. No? The hemoglobin content plays an important role in the maintenance of your color of the cell, which can be hypochromic or hyperchromic. Okay, the membrane abnormalities naman also defects as your spirocytes, yan, can also result to poikilocytosis. Your hemoglobinopathies can either result into anisocytosis or poikilocytosis. Okay? Next is the variation due to the presence of inclusion body. So, sinabi natin kanina, meron tayong Haynes body na nabanggit. So, yun ay isang inclusion body ng RBC. Okay. First is your diffuse basophilia. Okay. These are dark blue granules and filaments in the cytoplasm of your RBC. May picture ba? So usually, it looks like your cell, okay? Then meron mga, yan, may dark blue staining dyan. Okay? Nagkakaroon ng vasophilia ang iyong cell. So bakit? Possible, meron pa siyang RNA remnant. Okay? Because of the RNA remnant that still takes your basophil dyes. Okay, associated disease or condition, hemolytic anemia. Okay? After treatment for iron, vitamin B12 deficiency or folate deficiency. Next is your basophilic stippling. Okay? Dark blue to purple, fine or coarse punctuate granules, no? Distributed throughout the cytoplasm. Okay? Unlike your diffuse basophilia, no? This is more fine than it. Okay? Also, this is caused by your RNA, which is precipitated. When you say dark blue stain caused by your RNA, that's diffuse basophilia. But if you say precipitated RNA that causing dark blue purple um, granules, then that's basophilic stippling. Okay? Associated disease usually, no, hallmark for your lead poisoning. Okay? Thalassemia, hemoglobinopathies, megaloblastic anemia, and myeloptysic anemia. Next is your holly jowl body. Okay? Dark blue, dense. Okay? The word is dense, round granules. Okay? Unlike your first two, this is more bigger than it is. Okay? Usually, can only seen as 1%. Okay? Anong cause naman ito? It is due to your DNA fragments. Unlike the first two, you have the RNA. For this high-level jolly body is your DNA. Associated disease or condition, you have hyposplenism. Okay, if ever that you have removed your spleen due to postsplenectomy, okay, possible that your RBC will contain whole jolly bodies. Megaloblastic anemia, hemolytic anemia, thalassemia, and myeloptysic disorder. Next is your Heinz body. No, nabanggit natin to kanina. Round dark purple granule attached to the inner RBC membrane. To the inner RBC membrane. Okay? Usually, denatured, this is caused by your denatured hemoglobin. Okay? Your denatured hemoglobin. Associated diseases, G6PD. Okay, G6PD. Unstable hemoglobin. Okay? Oxidant drugs or chemicals. Next is your Pappenheimer bodies. No? Usually seen as your cluster of small, light dark granules. Okay? Often near the periphery. Okay? Caused by your iron. Okay? Pappenheimer, iron. Okay? Usually, no, nakikita as in the near the periphery. Okay? Caused by your sideroblastic anemia, which is caused by your increase in iron. Okay? Hemoglobinopathies, thalassemia, megaloblastic anemia, myelodysplastic anemia syndrome, hyposplenism, and postsplenectomy. Next is your Cabot ring, no? Usual in figure of 8 or rings, no? These are the remnants of your mitotic spindle. So, kung hindi nagtuloy ng mitosis ang iyong cell, it will have a remnant of this figure of 8 or your Cabot ring. Usually associated to your megaloblastic anemia and myelodysplastic syndrome. Okay. Hemoglobin H inclusions, no? The golf ball-like, no? Fine evenly dispersed dark blue granules, which imparts as golf ball appearance to your RBC. Ano yan mga yan? Ito yan. Okay. Nagkakaroon ng masyadong madaming blue, no? Granules. Yan, mga granules na yan. No? Causing na mukhang golf ball ang ating RBC. Sobrang dami nila. Okay? Precipitate of globin, B-globin, chain of hemoglobin. Okay? Usually associated to your hemoglobin H disease. Okay, miscellaneous, no? Additional variation of your cells. The rouleau formation or the stacking of coins. Paano yan? Magkakadikit lang ang RBC mo. Mukha silang pinagpatong-patong na cell. Na coin. Okay, stacking of coins. Ganyan, tsura. Okay. Partially hemolyzed RBC. Medyo nakabuka lang. Mukha siyang ganyan. Okay. Usually, mas malaki lang to siya. Schistocyte. Bakit? Schistocyte is a product of your hemolysis. Okay? Kaya, kung partially hemolyzed lang siya, this is either kamukha ni schistocyte, pero mas malaki. Okay? Acid stain of erythrocyte, no? Red cell is colored red. Too much stain. Alkaline stain, the buffer solution is too alkaline, dirty gray color. Okay? Design formation of RBC caused by your fat or oils in the slide ahead of the spreader during the smear preparation. No? Variation lang yan. Usually, hindi natin nakikita or nakikita natin sa normal RBC. Okay. So, that's all for your RBC variations.